We're back with Dr. Bilski, talking everything dental. And question for you is, what are the three most popular cosmetic procedures you get requested in your office?
Yeah, that's a good one. I think most people want a brighter smile.
Yeah, that seems to make...
They want straighter teeth.
Yeah.
And if they're missing teeth.
Okay.
So in our practice, start with the easy one, whitening, tooth whitening.
Okay.
It's not bleaching, it's whitening. And we have a system that does by far, it's called core whitening. It's on our website. You can Google it as well too. I think you should. There are two ways of doing it. We can do take home, and we can do take home and come into the office, meaning we combine the two. And we typically do the combination of the two with those patients that maybe had one time been a heavy smoker, or they are big time coffee, tea drinkers, red wine, cola drinkers. You know, It's just the natural or the normal things that we naturally do that stain our teeth. And if you are that person that has microscopically, if we look at your teeth, more porosity, the stain sticks on there.
Okay, makes sense.
And then those that have less, they're brighter, whiter, those typically are the younger people too. So as an example, my 18-year-old son, Rhett, he came in and we did the whitening procedure take home, and then we asked him to come back for his second in-office or first in-office appointment for the second part of this combination. And we're looking at him like, oh boy, those things are already off the white chart because he doesn't drink, doesn't smoke.
Yeah, right.
He doesn't drink coffee.
Lives a good life and you get brighter teeth.
You know, he's healthy and they're beautiful. And of course, he's my kid. So I said, look, why don't we have somebody else look at you that worked for us?
Yeah.
So the gals came in and they've known him since he was 4 years old, you know, so let's not do it. So that's a nice thing that patients should understand. So when you come in, if you just want to try the take home, you might be that person that is
done.
That's done.
Yeah.
And knowing that if it's not, you need to go to the second one. So it's not this like sales pitch out of our practice, because honestly, we'd rather have it simple and less costly so that you're comfortable, and perhaps that we kindly request that you refer your family and friends.
Sure.
And if somebody sees you at work,
wow, where'd you get that smile?
Yeah, like, what did you do? I just whitened it. Oh, I bet that cost like, no, it didn't. I did it at home. How long did it take? It took about actually 10 days, but I did it for 2 weeks. Then I went in for my appointment because I thought I needed more.
You told me I didn't.
And we didn't. Like, when's the last time?
Yeah, that's good news.
Yeah,
that's all good news.
It's very comfortable for the patient. And of course, us, we love it. So the second one would be, of course, your veneers. And then we talked about porcelain versus plastic, glass versus plastic. Porcelain made in the laboratory indirectly, or Provence, which is a nice way made by the same laboratory that we can place those. And then I think Invisalign probably, which is a tray aligner technique that it can be done at home, no wires. It's just a series of harder type football mouth guards that are a little thinner that you change out every 2 weeks, maybe every 1 week or every 3 weeks, depending on what our analysis will tell us. So those are probably the top three. Then closely after that, the uniform I have on right now, Aesthetics, we're involved with biofillers and Botox. So we do lips and cheeks and chins, and we get rid of wrinkles. We make plumper lips. We make brighter smiles. We make you look younger. Yeah. And if anybody asks, do you need to keep that up? Yes, it is a maintenance program. Unless, Randy, you can stop the aging process.
No, I haven't figured that out yet.
Then you only need one treatment.
Okay.
And that's what I think the most common.
Well, it's always good to know this stuff. And, if you're looking to tweak, sharpen, brighten, whatever you want, Bilski Dental can help you do it. Go to bilskidental.com if you're not already there. Some videos, some of the things Dr. Bilski was mentioning. You can learn a lot there. And then when you're ready to make that appointment, they can do it right online, can't they?
And they can. And just because I want to add to this, we are getting into the facial aesthetics and oral cosmetics. So it's not just your normal everyday dental visit anymore. Say you're coming in for your teeth.
Yeah.
I'm going to say, hey, Randy, I know you're here for your teeth, but in our practice, what we do now is we do a facial analysis. We may recommend, we may not recommend stuff for you, but we take pictures and we might discuss some things. I'm not pushing you towards that. Or if you're coming in for the facial stuff, we may say, hey, that's great too, but we also do an oral examination because what's inside.
Yeah, it's going to come outside, right?
Yeah, exactly.
Sure.
So we do a consultation for free, no obligation. And when you come in, you get a booklet. I think there's 38 pages with QR codes, that little like maze-looking block thing, if you're not familiar. You point your phone at it, and it takes you to a video. And it shows you the procedures.
For every one of those types of procedures?
Exactly, for the facial aesthetics.
That's pretty neat.
And then the stuff that we're working on right now with you guys is to get QR codes up there so you can just hit the screen and you don't have to click on anything. It's just
very neat.
Yeah. So
can they get that book?
You get
through your website, or you got to come in and meet
when you book.
You got to go. You got to book. Go meet Dr. Bilski, and then you get the book. But that's actually pretty. It's pretty neat offer.
Yep. So and that's standard operating procedure in our practice for that. So you will not be charged anything for that.
So
you want to ask for care aesthetics and facial cosmetic evaluation.
I have nothing more to add. Just head to the website, give him a call, do that, and stop in. He's a nice guy, good dentist, and Bilski Dental Group.